Exercise is recommended for the treatment of low back pain. However, the actual details of which exercises are most effective for low back pain isn't well established. And so an article by Sue published in Medicine looked at a walking exercise program compared to a spinal stabilization exercise program in the treatment of chronic low back pain. This study was a randomized controlled trial which included 60 individuals with chronic low back pain, so low back pain that had been present for greater than 3 months. There were 4 different treatments included in this study. There was a flexibility group, a walking group, a stabilization group, and then a stabilization plus walking group. Each of the exercise protocols aimed to have the individual exercise somewhere between 30 to 60 minutes, and these exercises were performed 5 days a week. For the flexibility group, it included a bunch of various different stretches. So they did a piriformis stretch, a hamstring stretch, a TFL stretch, an abdominal stretch. Camel was also included, and so they just targeted a bunch of different regions in the core area and also in the lower extremity. For the walking group, the individuals were instructed to have a fast-paced walk for 30 minutes, and they were also instructed to brace the core while they were walking. For the spinal stability group, there were 7 different exercises that were included, and each one of these exercises had multiple regressions and progressions, so that way the exercise program could be tailored to the tolerance of the individual performing them. The individuals were also instructed to perform these for 30 seconds and then repeat for 5 repetitions. The exercises that were included were a modified curl up, a plank, a side plank, a glute bridge, dead bug, bird dog, and then also a prone extension exercise, kind of like a Superman. The individuals in each of these treatment groups performed the exercises for 6 weeks. At the end of 6 weeks, the primary outcome that the study was assessing was pain, but they also looked at oswestry for function, a Beck depression outcome assessment. They also looked at medication use as well as core strength, which they measured through a prone instability test. The study found that there's a significant reduction in low back pain with activity in all 4 of the treatment groups. When they looked specifically at low back pain at rest, they found that there's a significant reduction in both the flexibility group as well as the spinal stability group. For the oswestry as well as the Beck depression inventory, they found that there was improvement in all 4 of the treatment groups. Interestingly, when they looked at the prone instability test, they found that the walking group showed the highest improvement, whereas the flexibility group showed the lowest improvement. And reflecting on the results of this study, it's actually pretty interesting, and the reason why is because when we look specifically at pain, all 4 of the treatment groups had pain relief. And so regardless if they're doing specific spinal stability exercises, going for a walk, or doing flexibility training, all of them had a reduction in pain. And so when we look at the study in a broader context, it really doesn't help us determine which exercises somebody should do, because all of them seem to be effective at actually reducing pain. One of the interesting things that I think we can take out of this study is that because all of these exercises provided some sort of pain relief, it might not matter as much what specifically they're doing, but what they will actually do. And so if somebody doesn't like to do core exercises and we know that they're probably not going to do them, it's probably not in their best interest to tell them that they need to do planks, side planks, bird dogs, and all of those things. If they like to go for a walk, maybe that's actually what we should do or tell them to do, because that's actually what they're going to do. And this study also highlights some of the mechanisms behind why exercise is beneficial for low back pain. We typically tell people, or the common idea is that spinal stability exercises are needed because the core is weak, and so we need to strengthen the core, and that'll help with pain relief. However, when we look at the results of this study, the spinal stability group really wasn't all that much better than any of the other groups. Even though the walking group instructed the individuals to brace their core, it probably didn't really build that much muscle. There's just not enough load to actually make those muscles adapt. In the flexibility group, there was probably very little, if any, strength improvements from the load of just stretching. And so actually strengthening and instability probably doesn't have all that much to do with why these patients are improving with exercise. It might have to do with just exercise in general and movement, or it could be some other factor.